Australia is facing a shortfall of 80,000 nurses by 2035, and while the federal government has released a national strategy aimed at helping the sector, reports out today say young nurses are leaving the profession in droves. Joining us today is Australian College of Nursing Chief Nursing Officer Frances Rice. Thank you so much for your time, Frances, today. Let's just start off. What do you think is making new nurses leave the industry?
There's lots of causes, Sally. Unfortunately, increasing violence, experience of violences and assaults in the workplace is challenging nurses to stay engaged in the profession. But we also know that nurses who aren't supported to enter the profession once they leave university struggle to stay engaged. And so there's lots of things that are causing nurses to leave early in their career, and we really need to see a good, strong implementation of the National Nursing Workforce Strategy to support nurses throughout their careers and to then support Australian communities to stay healthy.
And there is a big cohort of nurses who are trained who aren't currently working, though, around 70,000 who are registered but not in hospitals. What's behind this number? Because that's an extraordinary amount of the workforce who could be working.
Yeah, it's really challenging. There's a variety of reasons. There are nurses who are registered in Australia but maybe working overseas. There are at any one time around 45,000 nurses that are looking for work and trying to get back into the workforce. And, you know, that can be difficult for a number of reasons depending on where they live and what their qualifications are. But we do need to see a commitment from the regulators and from employers and governments to support these nurses to return to the profession if that's what they choose.
Well, the federal government has released this National Nursing Workforce Strategy. What is your take on this? Will it help retain nurses in the workforce?
It's a really important piece of work, and it's the first time we've seen a national policy that's addressing the nursing workforce. It's designed to retain and attract nurses into the profession, and we do need to see it implemented. All governments have endorsed the strategy, and so we need to now see how that's rolled out and implemented across the country. And the Australian College of Nursing is committed to working with all stakeholders to be able to do that and make sure nurses can do what they can and what is in their scope of practice and supported by funding and legislation by governments to enable them to do that.
Frances, earlier you mentioned about some nurses not feeling safe in the workplace, which is obviously completely unacceptable. But how widespread are these reports of nurses being physically attacked on the job?
It's really concerning, Sally. There's been a doubling of assaults against healthcare workers in the last 10 years, and it's now the second reason that healthcare workers are hospitalised is assaults. Now, that can be verbal assault or physical assault. Sadly, it is more common than you would think, and we've seen recent videos of nurses responding to violent outbreaks, but that's not our job as nurses. Our job is to care for people and provide for their health needs, and we should be able to feel safe when we go to work, and we need the public to respect that, and we need governments and hospital boards and every health service to support nurses and all healthcare workers to be safe where they're working.
Yeah, I mean, that is just the bare minimum, and we need our nurses. They do an extraordinary job keeping us all healthy and safe. So thank you, Frances, for your time today and for your insights. We appreciate it.
Thank you.